Welcome to our channel. Let's begin with the thought of the day. If you can change your mind, you can change your life. By William Thames. Today's topic is emergency drugs used in dentistry. But before we begin with today's topic, don't forget to drop a like, share our video, and please subscribe to our channel. Introduction. In dental practice, different types of emergency can occur which the dentist has to treat his own, if no physician is available at that time. The emergencies which can occur are SYNCP, hypoglycemia, diabetic, coma. Convulsions, asthmatic, attack, anaphylactic, shock, angina pectoris, acute myocardial infarction, cardiac arrest, acute adrenal cortical insufficiency, and drug-related emergency. Category of emergency drugs. A. Injectable drugs. Primary or essential. Epinephrine. 2. Antihistamine. 3. Narcotic antagonist. Anticonvulsant. Secondary or non-essential. 1. Analgesic. 2. Vasopressor. 3. Corticosteroid. 4. Antihypoglycemic. Drugs for advanced cardiac life support. 1. Sodium bicarbonate. 2. Lidocaine. 3. Atropine. B. Non-injectable drugs. 1.0 Zygen. 2. Vasodilating agents. 3. Respirator stimulant. 4. Antihypoglycemic agents. Bronchodilating agents. Injectable drugs. Plurning. Primary injectables drugs. 1. Epinephrine. A. Properties: it has got rapid onset of action, potent action as a bronchial smooth muscle dilator, anti-dash. Histaminic properties and vasopressor properties. B. Side effects: tendency to predispose the heart to arrhythmias and relatively short duration of action. Indication: cardiac arrest, anaphylaxis, or an acute asthmatic attack. D. Precaution: it should not be used in treatment of shock, because it can decrease the venous return with increased ischemia, and it can also precipitate ventricular fibrillation. It should be used with caution in pregnancy, as it decreases the placental blood flow and may induce pre-mature labor. E. The rationale for the use of epinephrine. Cardiac arrest is the beta stimulation of the myocardium. F. Availability for parenteral administration. Supplied in 1 to 1000 concentration, each ml will contain 1 mg of agent. Administration: it can be administered by IV or intracardiac route. Dental personnel may give it into the frenulum under the tongue. Dose is 0.32 to 0.5 mg of solution subcutaneously or intramuscularly. 2. Antihistamine. A. Drugs of choice: chlorpheniramine, diphenhydramine, pheniramine, malate, Avil. B. Indication: it is usually used in delayed allergic reaction in which onset of symptoms is more than 1 hour after administration of allergens. Precaution: it is contraindicated in management of acute asthmatic episode, as thickening of bronchial secretion results from the drug drying action. Xness: it's the most efficient. Availability: chlorpheniramine 10 mg per m, IV, diphenhydramine 10 mg per milliliter, and pheniram, C, maleate, amp 1 to 2 ml, I.m. 3. Anticonvulsant. A. Drug of choice: diazepam. An alternative drug is barbiturate. B. Action: diazepam or barbiturate will terminate seizure activity without pronounced Depression of respiratory and cardiovascular system. C. Side effects respiratory depression. D. Availability and doses Valium 5 mg per ml administration. It should be administratia. I.4.M. for narcotic antagonist. A. Drug of choice naloxone. B. Indication, it is pure opioid antagonist. And it is the drug of choice for opioid-induced apnea. C. Action more than one administration. MAV. Be needed because of its short duration of action. Administration. It is given I.V. but can be given subcutaneously or I.M. E. Dose 0.4 mg per dl. Secondary injectable drugs. 1. Analgesic drugs. A. Drug of choice morphine sulfate or meperidine. B. Indication acute myocardial infarction, congestive heart failure, intense prolonged pain and anxiety. C. Side effects CNS and respiratory depression. D. Precaution. It is contraindicated in here. Injuries and multiple trauma. It is also used with care in patient with compromised respiration. Availability morphine sulfate 10 mg per milliliter and meperidine 50 mg ml. 2. Vasopressor. A. Drug of choice methoxamine and phenyl ephedrine. B. Action adrenergic agonist. It produces mild increase in blood pressure due to peripheral vasoconstriction. Xness. C. Indication acute adrenal insufficiency, drug overdose, hypertension and allergic reaction. Precaution used in caution with hypothyroidism, bradycardia, partial heart block, myocardial disease and atherosclerosis. Dose methoxamine 10 mg per milliliter, phenylephrine 10 mg per ml 4 or IM. Corticosteroid. A. Drug of choice, hydrocortisone sodium succinate. B. Indication allergic reaction, anaphylaxis. Adrenal crisis. C. Action slow onset of action. 4. Antihypoglycemic. D. Drug of choice, 50% dextrose solution. E. B. Indication, to manage hypoglycemic episodes. Administration 4 or IM. Injectable drug for advance cardiac life supports. 1. Sodium bicarbonate. It is effective in management of metabolic acidosis. It elevates the pH of blood by combining with hydrogen in blood. Dose -300 to 500 milliliters of 5% sodium bicarbonate 4. 2. Atropine sulfate. It is a parasympathetic drug that decrease vagal tone. Indication, sinus bradycardia accompanied symptomatic hypertension. Precaution not indicated in patient with MI. 3. Lidocaine, used in cardiac arrhythmias especially those of ventricular origin. Non-injectable drugs, 1.0 xygen, most important drug in emergency. Patient with chronic obstructive pulmonary disease should be given with caution because apnea may result. 2. Vasodilator, drug of choice nitroglycerin or amyl nitrate. Indication, to manage acute anginal attack and MI. Contraindication, not given in hypotensive patient. Action taken sublingually, it acts in 1 to 2 MTS. Availability tab, nitroglycerin 0.1, 0.3, 0.6 milligram, nitroglycerin spray 0.4 milligrams, amyl nitrate vaporous 0.3 milliliters. 3. Respiratory stimulant, aromatic ammonia spirit used to treat syncope. Action, irritating the membrane of upper respiratory tract resulting in stimulation of respiration and blood pressure. Contraindication, used with caution in asthma, as it may precipitate asthma. Availability, silver gray vaporol, 0.3 ml. Availability, chlorpheniramine, 10 mg per m. I.V, diphenhydramine, 10 mg per milliliter, and pheniram, C, maleate, amp 1 to 2 ml I.M. 3. Anticonvulsant. A. Drug of choice, diazepam. An alternative drug is barbiturate. B. Action, diazepam or barbiturate will terminate seizure activity without pronounced depression of respiratory and cardiovascular system. C. Side effects, respiratory depression. Conclusion, in dental practice different type of emergencies can occur which the dentist has to treat on his own if no physician is available at that time. The dental office emergency kit need not, and indeed should not be complicated. It ought to remain as simple as possible.
Thank you. Have a nice day. Please do leave a like and press subscribe button.